Hi, I'm Matt Smeltzer from the University of Memphis. Sickle cell disease is one of the most common genetic disorders in the US, but there are disparities in research and funding. Newborn screening has been around for more than 30 years, yet we do not have a national sickle cell disease registry in the US. Centers for Disease Control is trying to been work to address these issues by establishing state-level disease surveillance programs. And right now there are 9 US states participating in this project, and we in Tennessee are one of them. We started our surveillance program in 2019 with capacity building, and we're hoping to have our first aggregate data reports ready this year. As the statewide program moved from capacity building to data reporting, we convened a meeting of our stakeholders to try to develop a clear vision and put data into action by understanding the priorities of our stakeholders and how to use this data to improve the lives of persons with sickle cell disease in Tennessee. So we had this vision casting session in February of 2021, and we asked each stakeholder before the meeting to come prepared to answer a question. If you had 3 magic wishes for sickle cell disease in Tennessee, what would they be? We then let each person share their wishes and had discussion around the wishes, tried to build consensus around our primary vision for this program. We used a graphic recorder, and you can see in the middle of the poster the graphic that was created from this project. The 3 wishes centered around better disease information and data, better care and policy, and more involvement in the community. Overall, people would like to see better data, have better access to data, and really to modernize how we present data on sickle cell disease. Around care and policy, stakeholders would like to see sickle cell disease be more of a legislative priority and would like to see it prioritized more amongst non-specialist providers. Within the community, they would like to see more involvement of patients in research and public health, increased awareness of sickle cell disease, and more age-specific materials for sickle cell disease. We've also identified the transition from pediatric to adult care as one period of time that persons with sickle cell disease are particularly vulnerable, and so efforts could be focused during this period. Overall, patients want honesty, transparency, compassion, and trust from their public health and medical professionals. Overall, we would like to put this data into action. We'd like to use the data to improve the care and address health disparities in sickle cell disease, but this is going to require researchers listening to stakeholders and understanding multiple perspectives to form unified goals. You can read more about this vision casting project and the reference at the bottom corner of this poster, and I appreciate your attention.